Again, I am starting. Okay. So, very good evening, everyone. On behalf of IAPEN India, IAPEN Kolkata chapter, and Community Nutrition Core Group, IAPEN, I welcomes you everyone to today's session, that is Metabolic Research of harnessing gut health and chrono nutrition can significantly enhancing GLP-1. So how GLP-1 can be naturally increased with the help of diet, lifestyle, sleep pattern. This is very important because if we are artificially taking also GLP-1 or the medication, then also you have to focus on your gut. So in our relentless pursuit of the metabolic health and sustainable weight management, we often look for the next magic bullet. But what if the most powerful prescription isn't the new drug, but it is returning to our internal machinery? Today, we are driving into the cutting edge of the science, the metabolic reset, not just by dieting, but by leveraging the synergy between our gut microbiome, the biological clock, the sleep patterns, and the healthy windows. That is, you are eating, that is the time restricted as eating for 8 to 10 hours and giving your gut a rest. To fix this, we are looking at two major pillars, that is harnessing gut health with the help of dietary fiber or healthy diet, and significantly the key is the keystone. So even we will from our eminent speaker, we will get to know about the chrono nutrition, how is it important in your metabolism and enhancing your gut. So we have our very young dynamic two speakers, that is Ms.Lisa Sarkar and Ms.Sriparna. So let me introduce Lisa and Sriparna. So Sriparna is Masters in Nutrition from Calcutta University, Certificate Diabetic Educators. She is working with many clinics. Her publication is on endocrine GLP-1 receptor agonist and smoking cessation, therapeutic promise beyond glycemia. So welcome, Sriparna. We have with us dietitian Lisa Sarkar. She is now, after completing her master's, she is now doing her PhD in system medicine, and where she is the assistant lecturer. There also as well, she is conducting her thesis in the School of Tropical Medicine. She has several chambers, rivers, awards in her name. So without any delay, I hand over to Sriparna to share the screen. And Lisa, you can already start. You can start before she shares the screen.
Thank you so much, sir. Thank you so much for giving me this opportunity to present in this beautiful platform. So we will be talking about chrono nutrition and a natural synthesis of GLP-1, how the GLP-1 gets synthesized inside our body. We definitely know about GLP-1 agonist receptors, like the medicines that we get from outside.
But we cannot see the screen.
It's visible, sir. It's visible.
Oh, it is visible? Okay, yes. Let me rejoin. Sorry for that.
No problem, sir. So it's very important that synthetically, very naturally, how we can get synthesize this GLP-1 inside our body through chrono nutrition, through the patterns, through the diet, through managing our gut microbiomes. It is very important. So we will be talking about the first slides. Can I get the first slides, please? Yeah, we will be talking about some metabolic disorders. So there are several metabolic disorders, but if we talk about the trending and a very rising metabolic disorder is this type 2 diabetes. So if it's a global phenomenon, it's a global burden. So almost 830 million people are suffering from. It's a statistical digit, that is 830 millions of people are suffering from almost worldwide. It's a digit from 2022. Now if we talk about 2026, it's almost increased, double or triple maybe. So almost 1 out of 9 adults are suffering from type 2 diabetes. 50% remains undiagnosed. and untreated, which leads to several complications. Those who have a cardiovascular problems can lead to stroke, retinopathy, kidney failures, amputations of like diabetic foot and neuropathy. 2 millions are directly death are directly attributed in diabetes in every year. So if we could see this, this is a very important, and like as I said, type 2 diabetes is one of the most biggest metabolic disorder right now the global peoples are suffering from. So rather only getting inside deeply, diving inside deeply about type 2 diabetes, we will be talking about GLP-1 and how we can manage, right? So from the next slides, we will be talking about GLP-1 domain. So what is a GLP-1? I think most of the HCPs are pretty well aware about GLP-1. It's a glucagon-like peptide. Actually, it's an incretin hormone. So if we talk about hormone, it is made up of protein, right? Now the proteins are it's a long hormone, consists of 30 to 31 amino acids derived from proglucagon genes, and it has a pivotal role in metabolic homeostasis. So it helps to maintain different metabolic, it reduce down metabolic disorder and maintain the homeostasis, metabolic homeostasis. Now, the first point is the glucose-dependent insulin secretion. So that's the main reason why I'm focusing this particular line is just because it's a glucose-dependent insulin secretion. The chances of hypoglycemia is less in case of that. It gets secreted from L cell. In a further slides, we will be talking about how L cells activate. What is the mechanism through which we could synthetically mention we can get or activate GLP-1, right? It's a metabolic regulators also. From the next slide, please. Okay, now this is a very easy. I tried my level best to make this GLP-1 pathway a little easy so that everybody can understand. So if we talk about this nutrient intake, so one thing we have to understand from protein, carbohydrate, bile acids, short chain fatty acid, everything can stimulate GLP-1. Okay, so nutrient intake, once we take nutrient, what it happens is it gets inside, it gets absorbed in intestine, right? So there is a cell called L cell. Now this L cell gets activated and there is a receptor. There are normally two receptors. We will be talking further about this. First receptor is FFAR2 and FFAR3, right? Now this receptor opens up. These receptors are activated. What happens is once we take fiber-rich food, fiber-rich things, this fiber gets fermented inside the lumen of intestine. Now this, once it gets fermented, it produces some metabolites. So what are the metabolites? Metabolites are something which helps in metabolisms, right? They're like short chain fatty acids. These metabolites activate the receptors like FFAR2 and FFAR3. After activation, it provokes to produce GLP-1. That we already know what is a GLP-1, right? Once this GLP-1 gets secreted inside our body, it's circulated through bloodstream and has an effect on targeted organs. So what are the targeted organs we have? It has an immense effect on stomach. Why? Because it suppresses appetite. It helps, once it suppresses the appetite, definitely we don't have the interest to eat. So it will help to reduce down the calorie intake. It will slow down the gastric emptying, right? And have a prolonged satiety level. So that is the only reason why GLP-1 is a main and important factors to reduce down our weight, right? So that's why we used to take medicines named as GLP-1 antagonists, right? Okay, it has an effect on brain. It helps in signalings of brains. It helps to reduce hedonic eating. So we need to understand what is hedonic. Hedonic eating is something like eating which gives you pleasure. Sometimes we eat food to maintain our satiety. Like I'm hungry, that's why I'm eating. And hedonic eating is something, it's a pleasure. For example, I might be right now, if I feel like eating some chocolate ice cream, it's a pleasure eating. It will not fulfill the satiety. So this type of munching that normally happens during night shift people, those who are doing, sometimes we students, once we started studying, we have a munching problems. So these GLP-1 plays a very important role to reduce down this hedonic eating. It influences the dopamine reward signaling also. That's why it's get exposed in addictions like alcohol uses, binge eating, as I said earlier, right? Now, what about the cardiovascular disease? Heart, it's an important target organ. It improves oxidation state. It helps in reduce down the vascular inflammations. In liver also, it reduces on hepatic gluconeogenesis, lower down like liver lipid accumulation, improve insulin sensitivity. We definitely know it has a great impact. GLP-1 is it's a hormone which is only known for reducing the blood sugar level. So it improves the insulin sensitivity. So this is how the GLP-1 gets secreted or activated inside our body. So there is a thing which I would like to add is DPP-4 inhibitors. So we need to understand is GLP-1 mostly prevent GLP-1, yes, it prevents GLP-1 breakdown. So what it happens is, if you could see this area, I don't have the card set, so I can't even show you. It prevents degradations of GLP-1, DPP-4 inhibitors like linagliptin, gliptin-based medicine we use like linagliptin, sitagliptin. So these are the medicines which prevent the degradations. It's okay, I don't need it. Thank you so much. Okay, so what are the overall effects? So the overall effects are it lowers down blood glucose level, it helps to reduce down our weight, it has an immense effects on cardiovascular protections and does improve the quality of life. So these are some clinical implications like for the type 2 diabetes, for obesity management, for cardiovascular disease also we use GLP-1. How, and this is how we need to synthesize our GLP, the inside GLP-1 secretions. Next slide. Okay, now we will be talking how gut plays an important role. What is a connection between gut and GLP-1? We will be talking about brain and GLP-1 axis also. So gut, in the previous slide, I just very simplified the term that once we eat fiber-rich food, it gets fermented inside our body. Once it gets fermented, it activates the L cells, produces through the different activators that we know, as I told you, like FFAR2, FFAR3, right? So here I just want to add one more thing. Bile acids also plays an important role. What it happens is GLP-1 bile acid, primary bile acid gets converted into the secondary bile acid. The secondary bile acid, then it activates another receptors, which is TGR5, not that FFAR2 and FFAR3. FFAR2 and FFAR3, please understand these two receptors get influenced by short chain fatty acids. And TGR5, it's another receptor. This receptor gets activated or influenced by bile acids. Now that primary bile acids converted into secondary bile acids. Now this triggers or influence the receptors named as TGR5. Once this TGR5 is activated, it strongly produces GLP-1. So again, it's an important factor. Okay, now how gut is important, as I told. Now the fiber-rich food. Now we will be talking about prebiotic, probiotic in further slides also. Sriparna is going to talk about what are the prebiotic sources, what are the probiotic sources. Now the prebiotic fibers, which is considered as a good food for probiotic. Probiotic is beneficial microorganisms. There are trillions, billions, and trillions of live organisms which is present in our body. But not every microorganism is good. If we talk about some beneficial microorganisms, this prebiotic fiber, it enhances some good bacteria, that is good microorganism, and thus helps in secretions of GLP-1. We already talked about the metabolic benefits like weight management, metabolic health, reduce down dyslipidemia, then brain signalings. We already talked about it. Now, it's a main thing which I would like to add over here is gut-brain axis. GLP-1 has a it interacts the signaling. Okay, so it interacts with vagus nerves. It interacts with hypothalamus. So what it happened is gut always talk with the brain first before the brain start to initiate the hunger. If we have to understand, gut always talk with the brain before it decide hunger. So we need to always maintain our gut in case of that. So this is how the gut and brain axis are interlinked with. And gut microbiomes indirectly regulate our incretin biology. Incretin is GLP, right? Okay. Next slide, please. Okay. Here I have already mentioned some good bacteria like Bifidobacterium, Lactobacillus, Roseburia. These are some good bacteria which will help to produce short chain fatty acids. Now, as we are talking about short chain fatty acids, simplifying, I'm just trying to simplify the this short chain fatty acid word. Short chain fatty acids mostly are butyrate, propionate, and acetate. Okay. Now, this short chain fatty acid, what is the function? That's very important. Butyrate is nothing but a fuel for colonocytes. Okay. And also plays a very important role in anti-inflammations. Though many of us knows about it, if it is not, still I would like to add one more topic, one more sentence, a point we can say. It's especially it inhibits ACS, that is histone deacetylase. Now, what is it? It is nothing but a gene expression. It helps to alter the gene expressions also. So butyrate is very important. So it acts as an anti-inflammatory units for our body. If we talk about propionate, it stimulates GLP-1. It helps in PYY. We know, like peptide YY. It's also it's something which helps helps us to feel full. Satiety. It helps to feel. It's also gets secreted from L cells of intestine. And if we talk about acetate, it helps in appetite control and also lipid metabolism. So these three short chain fatty acids are excellent metabolites. And how this short chain fatty acid or metabolites get secreted in our body through different good bacteria. This good bacteria. So definitely for the good bacteria, we need food. Otherwise, they won't be able to sustain. So see, if we could see, it's interrelated. It's connected. So good food, that is prebiotic fibers, helps in a formation of several good bacteria, that is beneficial bacteria. Now these beneficial bacteria helps in fermentations and helps in production of short chain fatty acids. This short chain fatty acid again helps in L cell activation to produce GLP-1. So it's an interrelated and it's a chain that we need to understand. And there are some other bacteria which is what we call is not that's a bad bacteria. What are that? See, we have like Clostridiums, like Proteobacteria. So this causes dysbiosis. So we need to understand what is dysbiosis. Dysbiosis is nothing when good bacteria, beneficial bacteria comes down, and the harmful bacteria increases inside our body. So this is what it's very easy to understand. I tried my level best to make some colors over here so that we can identify some beneficial and some harmful bacteria and what is its clinical relevances. Next slide. Okay, so now we will be talking about chrononutrition. It is a very interesting topic, and we always focus on nutrient. What are the nutrients? That's, as I already told you, that we need to focus on prebiotic fibers, short chain fatty acids, different fibers, and how it gets activated, how it gets fermented. But what is our time and how we should take it? It is also important. So my co-speaker, Ms.Sriparna, is going to talk about chrononutrition and how and why it is so important for our maintenance. So over to you, Ms.Sriparna.
Thank you so much. Am I audible?
You're audible.
Okay, thank you. Thank you, Lisa Di, for the brief discussion, and thanks to dietitian Shomendu sir, IAPN India, and Community Nutrition Core Group for organizing this wonderful session. So, as of now, we already concerned about the food quality, quantity, and what really matter with GLP-1. Now, I am going to discuss about the term chrononutrition, the body's internal clock, and how it connect with the GLP-1. Okay, let me ask the audience first. Does anybody have any idea about the term chrononutrition? Anyone, please, you can unmute yourself.
Yes, you can tell in any language, Bengali, Hindi, English. Chrononutrition মানে কি? What is chrononutrition? Anyone? I have already explained in the beginning. You can raise your hand and say. No idea?
Okay, let's walk through this. Chrononutrition is the study of how timing of your food intake interact with your body's 24-hour circadian rhythm. This is basically a 24-hour cycle, and the concept based on time restricted eating or time restricted feeding. I will discuss the term later, what is time restricted eating or what is time restricted feeding. And coming to the biological function, the suprachiasmatic nucleus of the hypothalamus function as central clock and connect the peripheral clock to complete the whole molecular basis of mammalian biological system. And chronic misalignment of these, yeah, if we don't maintain the circadian rhythm, if we don't take the right food in proper time, this can lead to increased risks of diverse metabolic disorder like insulin resistance, weight gain, chances of diabetes, fatty liver, etc. So the keynote is it not just what you eat but when you eat is also matter. Now, coming to the mechanism of action, this is a very interesting pathway how the circadian rhythm connect with GLP-1. So, this is basically a feedback action which act as environmental light and dark cycle. So, in this slide, this is the morning circadian and GLP-1 activation flowchart. So in the morning, when the sun rises, the retinohypothalamic pathway of the retina activate the suprachiasmatic nucleus and deactivation of paraventricular nucleus occur. And this activated suprachiasmatic nucleus now leads to activate certain transcription factor like clock and BMAL1, those who have their own repressor and cryptochrome and leading to a strongly self-regulated feedback loop. Now, this clock and BMAL1 gene directly link to the peripheral clock modulation of liver and
If you
pancreas.
can use your pointer, it will be helpful for all of us.
Okay, 1 second, sir. Yeah.
Yes, you can.
So this clock and BMAL1 gene now directly linked to the peripheral clock modulation of liver and pancreas. How? It acts in two ways. Mainly, number one, the clock gene expression directly influence the GLP-1 signaling, and the BMAL1 regulate the intestinal L cell which secrete the GLP-1. And with the activation of this metabolic gene, the body's cortisol level increase in the daytime and melatonin decrease in this time. Now, in this slide, this is the exactly opposite action, the feedback action. So, with the sunset, when the night approach, the opposite action, the feedback action occur, and now deactivation of suprachiasmatic nucleus and activation of paraventricular nucleus leads to suppression of these metabolic consequences gene like clock and BMAL1. So if we take the high calorie or high GI food in the later evening or in the night, then this metabolic gene may not express at that time. And that's why the metabolic consequences like insulin resistance, type 2 diabetes, weight gain, fatty liver may occur. So There are various study in this topic how GLP-1 connects to the timing of your food intake, why the glucose connection matter with the timing of food intake. So here all the practicing dietitian can relate that since the middle of 21st century, eating pattern have shifted towards later eating time, means people are consuming one third of their calorie after 6 p.m. There have been seen a later chronotype. People are skipping their breakfast or taking very low calorie in the earlier time of the day and taking high calorie snacks or high calorie dinner on that day. So there are various study. One of the interesting study I found in PubMed, a 16 years old follow-up cohort study in US, which showed that men who skip breakfast had 21% higher chances to develop the type 2 diabetes compared who were consuming breakfast. This is basically people, those who are skipping breakfast, they are tend to they are craving in the late evening or late night and taking high calorie, high GI food in the evening or night when the GLP-1 is not activated, when the metabolic suppression, when the metabolic gene like clock, BMAL1 I already described, suppression occur. Another study in China, a 2 weeks intervention and 2 weeks washout period of having breakfast demonstrated that omitting breakfast leads to significantly higher energy intake in the evening and which cause lower postprandial insulin sensitivity. An acute study in T2DM also saw a later chronotype pattern also seen higher HbA1c value. So the summary is if we don't take the high calorie or nutritious breakfast, if we don't take more nutrition in our earlier time of the day, we will crave the fast food. We will if already the protein deficiency done from the morning, we will crave in the evening or in the night, and intentionally or unintentionally someone is taking high calorie or high GI food, which leads to insulin resistance because in this time, due to this metabolic gene do not act and the GLP-1 may not activate as it required. Now coming to a very interesting case study, a 24-year-old female girl who 24-year-old female nurse with diabetic who switched to from day to night shift and is now struggling to manage blood glucose. Now what will be your practical tips to manage in this situation? So anyone from the audience, can you share some tips in this situation? How can she manage her blood glucose? Anyone, you can unmute yourself,
You are
please.
saying she is diabetes, she is a nurse, she is doing her night shift, and how will she manage? So
Yeah.
anyone can say how to take her foods, or anyone. Just it is to
या
understand
ये
from the
बहुत ही एक
student.
कॉमन क्वेश्चन है जिन लोगों का नाइट शिफ्ट होता है. क्वेश्चन तो रहता ही है कि हाउ वी कैन मैनेज द ब्लड शुगर इन इवन इन आवर नाइट शिफ्ट. सो सम प्रैक्टिकल टिप्स.
That is the glycemic extremes.
या.
How will you manage the glycemic extremes? Sometimes
Oh,
lactate hypos are there because they are working, they are not sleeping. So how they will manage? Any ideas? Any practical tips from the audience or from the students? In no one. Okay, so Chitra wants to
okay.
try. Chitra, unmute.
হ্যাঁ স্যার, আমরা মানে যদি নাইট শিফট থাকে আর সেক্ষেত্রে যদি ব্লাড গ্লুকোজ মেনটেন করতে অসুবিধা হয়, সেক্ষেত্রে আমরা বলতে পারি যে আর্লি ডে বা দিনের প্রথম দিকের টাইমে বা আর্লি মর্নিং এ একটু হেভি মিল খেয়ে বাকি সন্ধ্যের দিকটাতে একটু লাইট মিল নিতে, বা রাতের দিকে যখন হবে তখন আমরা ফাইবার রিচ ফুডটাকে একটু অ্যাভয়েড করতে বলতে পারি।
Definitely.
Okay,
Okay.
Annesha.
Yes, sir. I think at night we can suggest some legumes which is fiber rich and protein rich also. Some fermented legumes, like, food.
So you have to totally manage the entire day meal. You cannot just say change one meal or one thing because there will be glycemic extremes in the meal. And okay, if you want to carry on, we will take the question
Okay.
during the
Okay.
interaction.
So, in this condition, I will give her four practical tips. Number one, front load of your day. That means consuming more than 60 to 70% of your calorie whenever you are starting your day. It may be afternoon or late afternoon in your night shift, but remember that your earlier meal should contain more calorie and nutritious, and with the day passes in the night you have to take lighter meal rather than your earlier meal. This is because we already know the metabolic gene activates in the daytime, which secrete the GLP-1, and the GLP-1 suppress in the night time. So the number one tips is front loading your day. And number two, consistence a eating window. In the first slide, I mentioned a time restricted eating or time restricted feeding. So this is related to this. So consider a time restricted period of 8 to 10 hours. That means consuming that 60 to 70% of your calorie within this period of time. So suggested window for a night shift worker may be maybe 12 p.m. to 8 p.m. or 11 a.m. to 7 p.m. That means consume the high calorie or nutritious food within that time, and restrict the time according to your shift. And number three, which is very important, respect a food order. Like whenever you are having your breakfast, lunch or dinner thali, try to take the non-starchy vegetables or fiber first, then the protein, and then the carbohydrate like cereals to maximize the GLP-1 effect. And number four, watch the night cap. Means avoid heavy meal or high GI snacks at least after 8 p.m. You can take some high fiber or high protein snacks during your night shift. Some example we already know, like roasted makhana, roasted chana, chickpeas, yogurt with some berries, veggies with hummus, boiled egg salad, roasted quinoa snacks or puffs, some mixed seed salad or chicken salad with some yogurt we can have. We dietitian can help to manage with various different recipe and food item in this case. Now, in the next slide, this is the adjacent therapy. How prebiotic, probiotic and symbiotic can regulate the GLP-1, which is already discussed by my co-speaker Lisa. Now I am giving a chronological. If we are only taking the prebiotic, any time of a day can be beneficial. We all know the food source like garlic, onion, leafy vegetables, whole grains like oats, barley, quinoa, pulses like lentil, chickpeas, and some seeds like flaxseed, sunflower seed, pumpkin seed, etc. And next, if we take the probiotic alone, then the best time would be with or within 30 minutes of your meal. Example, yogurt, kefir, buttermilk, fermented food like vegetables like kimchi, sauerkraut, and aged cheese, and very common South Indian traditional dish like idli, dosa. And now the coming to the symbiotic, this is a combination product of prebiotic and probiotic. The recommended time to take in empty stomach or taking them with a meal containing some healthy fat. This is because if we take probiotic, prebiotic, or symbiotic along with healthy fat, then the unsaturated fatty acid or omega 3 fatty acid can help to reduce the gut inflammation and making the environment more friendly to colonize the probiotic. And in return, this probiotic, this gut bacteria now help to metabolize this fat into short chain fatty acid, like already mentioned by Lisa, the butyrate, acetate, and propionate, which regulate the intestinal L cell and which secrete the GLP-1 secretion. So this is all are interlinked actually. Now, a overall dietary strategy to maximize the GLP-1. There are mainly four strategy we have to remember. Number one, boost the fiber intake. Already explained by my co-speaker how high fiber food can stimulate the GLP-1 release. And if we take the fiber first, or if we take more fiber with our meal, then the soluble fiber which present in some vegetables, foods or whole grain, that mix with the intestinal water and form a physiological barrier. It form a gel-like barrier in the intestinal wall, and which actually trap the glucose molecule. Like if we take the fiber first, this intestinal barrier will protect the intestinal wall, and then if we take the cereals, then these cereals I mean if we take the carbohydrate, then this carbohydrate may not release in the blood uh, quickly. Like a long stay of the carbohydrate in the gut will happen. So this is the beneficial of fiber intake because of this physiological barrier. And number two, incorporate some healthy fat, like include unsaturated fat like avocado, nuts, seed and olive oil to help to stabilize the blood sugar and support the GLP-1. And number three, avoid the trigger food. Like minimize the refined carb, sugar, sweetened beverage, fast food, and processed food, which can inhibit the GLP-1 regulation. And one of the important thing, this is all applicable for natural GLP-1. And those who are taking the GLP-1 medication, there are various side effects like nausea, vomiting, diarrhea. This is because when we take the GLP-1, GLP-1 significantly slow the stomach emptying, and with that this trigger food also stay in the stomach for extended period. So there happen double trouble. So if we don't take so there will be a gut pressure, and bloating may occur due to long stabilization of this trigger food in the gut. So it's better to avoid the trigger food when in GLP-1 medication or in case of natural GLP-1. And number four, eat mindfully and regularly, like practice eating chronologically, mind the eating of your time, and smaller regular meal to manage the appetite and avoid overload to your digestive system. Now, this is the key lifestyle pillar for GLP-1 management. Number one, we already discussed about the early time restricted eating, that consider a time restriction of eating window of 8 to 10 hours, and then front loading your calorie, like eat larger nutrient dense meal earlier in your day and smaller lighter meal in the evening. And number three, this is very important, prioritize your protein. High protein thali decrease the glucose spike and help in GLP-1 function. This is actually how this is happen. Protein is a powerful trigger for the GL hormone like GLP-1. So if we take more protein, or if we take the protein in our meal sequencing fast, then this stimulate the hormone like GLP-1, which signal the pancreas to release insulin earlier and more efficiently. And they also tell your brain that your gut is full, and by this way we can cut down the carbohydrate intake, or we can cut down the calorie intake. And number four, avoid nighttime eating. If in your general shift, like finish your last meal at least 2 to 3 hours before your sleep. And number five, optimize or reset your nutrient intake. Maintain the meal mnemonic, which stand for muscle maintenance, energy balance, avoid side effect, and liquid intake. So in the next slide, this is a meta-analysis evidence from randomized controlled trial, how the probiotic improve glycemic control in type 2 diabetes. And I am handed over to my co-speaker Lisa Di for the explanation.
Nicely explained,
Sorry
Sriparna.
for the interruption. We have time crunch. So how many slides are left?
Only 2 slides left, sir.
2 slides, sir.
Okay, okay.
We will be
Then we
covering
have
that.
question answer.
Yes, as we are
Okay.
running out of time, I'll be just discussing it very fastly. So we will be talking about some meta-analysis. So meta-analysis is nothing as a statistical phenomena. It's a statistical way. What we do is in several individual data, we gather some individual data and then we conclude or draw a single data from a single question. So this is what the meta-analysis is. So why I have given this meta-analysis to understand all the slides that we have prepared. It's everything is research based. So we can see over here in the footnote also, write down this slide. It's a source given. So anybody, if you want to go and you can get the access over there. So this meta-analysis normally conclude that it includes 14 RCTs, randomized 14 randomized control trial with the 842 participants, which goes around. The duration is for about 4 to 24 weeks. It has been administered various probiotic strains and doses, and gradually these are all safe as per the RCTs. And all the database has been all the database has been extracted from PubMed, Embrace's Cochrane Libraries Web of Science, and it's a very recent. I think if we talk about the meta-analysis, this paper is a very recent publication into 2023. If we see the left-hand side, the study selections out of, I think, 1248, we could see after the inclusion and exclusion, there are some inclusion and exclusion criteria that we researchers need to maintain. So after that, we get around 14 RCTs. Now, the primary outcome that we need to understand is that while designing this meta-analysis, the researcher has a hypothesis that it might go in a positive way for HbA1c, for fasting glucose, HOMA iron, fasting insulin, body weight, and inflammatory parameters. So that's the hypothesis. That's what they want to extract. They want to conclude. So if we could see from these 14 RCTs, 12 has a positive report that has been shown. 12 positive report has been shown in favor, that goes in favor for HbA1c reduction. 12 goes in favor of fasting, 8 for HOMA iron, 7 for insulin, and 10 for body weight, and CRP for 6. So these are the study. If we could see in right hand side, this favor prebiotic and probiotic. So what I'll say, for about, if it is 100 participants, 50% has been given placebo. Placebo in the sense they have been given a controlled diet. They don't know what they are giving. And 50% has been administered with various strains of probiotic. So after the conclusion, after the analysis, they have come to the conclusion that 50% participant, those they have given the probiotic, have a great impact, has a great reports, have a positive reports for HbA1c reduction, along with fasting glucose, HOMA iron, body weight, like BMI and everything, and also inflammation parameters. So this right hand side is a forest plot that they showed. It's a graphical exchange. And if we talk about potential mechanism, I am not going to take this I'm not going to take this a recall, because we have already discussed. So it's a research paper that also, this is an evidences that shows that how probiotics, and not only this 14 RCTs or not this meta-analysis, everybody can find out several others. In fact, I am also doing a meta-analysis on the prebiotic, probiotic, and symbiotics, and hopefully I'll be able to publish very soon. So there are several research which shows that it has an excellent effects. The probiotic has an excellent effects in glycemic controls in type 2 diabetes. On the next slide, please. We will be just simply cover this up, the metabolic reset model. Resetting in the sense is, again, we are setting a model. So there are 6 steps, like we need to reset the food intake. We need to reset the timing also, that Sriparna has already discussed about. Not only focusing about what are the food we are taking, but also focusing about what is the time we are giving the patient. We influence the time also. right? We need to reset the microorganism. We need to make sure our gut microbiomes needs to be balanced. It should be a homeostasis. It should be balanced so that the short chain fatty acid synthesis would be more. Once it will be more, it will reset the metabolites. The metabolites will be increases. That will reset the signaling actions like GLP-1, PYY, AMPK, and also some activations for inflammation. These are all inflammatory parameters also. It helps to maintain the inflammatory parameters. Thus, it reset the metabolism, does reset the overall health patterns. Here, I would like to conclude by saying one thing: type 2 diabetes right now is to be considered as a chronic low-grade inflammatory disease, originated partly from the gut. I think sir would agree with me. Shomendu sir, like right now we consider this is a inflammatory disease also. It's a chronic low-grade inflammatory disease. So we need to also focus upon the inflammation. So we need to put food in certain manners so that we can reduce down the inflammations. Thus, we are going to end our slides and PPT. Thank you so much. These are the key takeaway. Like we understood that what to reset and how we can reset our gut, how we can reset our metabolism. It is not about, I have already spoke about it. It is not about what we eat. It is also when we eat. The timing matters. Metabolism is a closing time. Respect the clocks to attain the glucose spike. So timing is very important. We need to focus on time. Thank you so much.
Thanks. Thank you so much, Ms.Lisa, and thank you so much, Ms.Sriparna. So almost everything we have covered in this presentation, from the evidence-based to the practical scenarios. Just I have one or two questions, and we request the audience or the delegates, because there are many senior dietitians, even our Secretary Ma'am Sudeshna Ma'am is here with us, and students are. So one patient you can stop share the screen. One patient walking into my chamber today. She is 48 years old lady. Her BMI is 25. She used to take sedative. Lisa, she is on Janumet, that is sinagliptin and metformin. Her BMI is 25. Again, I repeat, and the patient asks for GLP-1. That sir, please give me GLP-1. And her husband is a doctor. He is very much obsessed that no, you are not the patient for the GLP-1. But she is into the modeling profession, so she wants to reduce her weight. She wants her BMI to be very much perfect. So what will be your say? And she wake up she take her breakfast at 2 p.m. So she is also very much late for today's chamber as well. So should doctor or endocrinologist, they will start GLP, or what will be your first and foremost dietary intervention to this patient? Ipana or Lisa, both of them you can answer.
I can just tell one thing. Once the patient wants to have GLP-1, I would like to counsel the patient not only focusing on only the GLP-1 antagonist, like from outside. We can make them understand like proper diet is important. Now there are so much solutions. I think there, if somebody is,
I will I will cut you, and I will interfere here. The first and foremost thing should be sleep. We will prioritize on sleep and gut. Obviously, diet will come, but first, if you do not wake up, at least if she do not start her day at least 11 a.m. Her partner is saying that she should start the day at least 8 a.m., 9 a.m. But from a prolonged period of time, she used to wake up like 1 p.m. and taking her first meal in the 2 p.m. And she again going to sleep after the taking sedative 2 a.m. So 2 a.m. to 2 p.m. is the clock. But it is intentional. Because what it is very clear from Sriparna's talk, that Sriparna you have highlighted, the first you have to maintain your biological clock or circadian, that is the timing management. And regarding protein, what will be your say? Because muscle patients used to have muscle breakdown, though the muscle strength was perfect for this lady.
in this case, for this lady.
She has drastically lose 10 kgs in 2.5 months, and her skin tones and everything she is very much worried about. So what will be your saying? Because already she is taking too much of protein. Already taking, because she wants zero carb diet. First and foremost thing, we have set criteria, because I am not the dietitian. She is the dietitian. She is instructing me that you give me GLP-1, you give me this high protein diet, 100-gram protein. You totally cut down all my carbs from my meal, and so then said, why you came to me? You can declare your own diet. So the doctor is saying that this is the main problem, because she knows everything. So this is the problem, that taking too much of protein will also not help if you are not at least having some amount of carb or energy, because below 25% carb is not recommended in this time. Time restricted can be done. Achha, so I move to Anindita ma'am. Anindita Mandal ma'am is there. She has raised hand. I missed her. Anindita ma'am, you can ask questions.
So I have a questions to Sriparna. So you've explained very nicely. I'm so happy to get you and Lisa. So I know I love her and I know অনেক দিন ধরে জানি আমি লিসাকে. So Sriparna and Lisa, most welcome. And I just wanted to know if someone is asking you and the office goers, the GLP-1, when should I take? Which day should I take? Generally, doctors are giving that GLP-1 the Sunday. So always is it recommended to give the Sunday, or what is your opinion? I will share my opinion, but I wanted to know from you guys. What is your opinion? Because there are lots of, the side effect and the gut problems they are facing 1 or 2 days. So if the office goers are going to the office, so how they will manage the office days if they are taking the Sunday? So what is your opinion?
Yeah, this will be great for him or her to take in the off day, because in the beginning there may be some side effect like nausea, vomiting, already we discussed. But later with the dietary pattern, with the meal shifted timing, we can manage the dose with weekdays or working day also. If he or she can tolerate, or if he or she can manage her time according to the diet, then we can shift the time accordingly with her lifestyle.
Okay, thank you so much. Because that was my question. Because I generally observe that after 1 day they are facing the problem. Isn't it?
Yeah,
What
yeah.
is the opinion about the
Shobik
Lisa?
is also
Because
there. Shobik,
it
if you
depends
want, you
upon
can also
person
add.
to person vary करता है ना. So 1 day after someone is facing the loose motions, and
Yeah, yeah,
sometimes after 248 days also. So I generally asked my doctor that you can shift in the Friday.
Friday or
Then
Saturday,
from
then
then from Monday they can go to the office very nicely,
yeah,
and
yeah.
home. I think it's my opinion, and I just wanted to know from you guys.
Yeah, this will
Shobik,
be
you want
great
to say
actually.
anything? The patient will take the GLP-1 on holidays or Sundays when they are newly starting, or what is your opinion? I think he is busy right now. Acha,
So
moving
Vic,
to
you are in a
Jyoti. Or,
yeah, please me.
একটা প্রশ্ন হ্যাঁ হ্যাঁ yes, can you please repeat the question
Are you
once
there?
again?
Actually, I asked
Yes,
the questions because generally I observe if the gut problems is going on after taking the GLP-1, generally it started after 1 days, it's 24 hours. Some persons
yes.
is asking me after 48 hours they are facing the problem. And generally doctors are giving that GLP-1 on Sunday. I observed and I explained to my even the patient, if it is a problem for the 2 days, then you can take it on Friday night, then you can get the Saturday Sunday in your hand, and from Monday say you will be the okay. So what is your opinion, and is it okay, my views, what is that?
Right. Basically, this is because of onset of action. So, the medicine onset of action is based on their nature of
Ah,
body or comorbidities
everybody will
and
not
body.
have the same problem. I
and the
agree
same
to
problem,
keep
yeah,
Shobik.
actually depends upon the patient.
Everybody will have not the same problem, and
Yeah.
everybody are not in the same profession also.
Hmm.
Yes,
So
yes, yes.
there
And
is no
some
hard and
people
fast rule to
are
start
having
on Sunday.
repeated issues sometime. So some people having some allergic effect, some people don't have, insomnia. So those who are having high inflammatory factors, we can check also. So they can be facing more issues than the normal person who are only obese without any comorbidity. So whenever we are giving this similar medicine to different kind of parameters, different kind of people, so we have to study in the both the ways, like how we can tackle with. So we our counseling session is very important for each and every patient. So nicely explained,
Yes,
Thank you.
actually.
Lisa and
Thank you. So good
Sriparna. It's
And
explanation.
very
both of
nice.
you explained very nicely. And the thing is
Very
that,
nice. You were proud
yeah,
of you.
if they cannot change the behavior, then it's the dependency, it will over because the GLP-1, how much you will give? 15 maximum. Then also you cannot change the behavior, that the problem will be the same after 2, 3, 4 months. তো যেটা সৌমেন্দু
Understood.
বলল না, পার্সনটাকে আমাকে বলতে হবে তাড়াতাড়ি ঘুম থেকে উঠতে। That was the most important things rather than the having the.
Lifestyle modification is the
Yes,
main
your
key
modification
actually.
is very
Absolutely.
important. Yes.
Thank you guys. Thank you
Jyoti.
so much.
Thank you.
Thank you, Anindita
Thank
ma'am.
you.
Thank you. Any Jyoti, Khushbu. Thank you, Shobhita.
Very nice.
Jyoti, Khushbu, you have any question?
Jyoti ma'am, I think I have a question. I have seen, I think she's talking about PCOS, no ma'am?
Am
I
I
couldn't.
audible?
Yeah, you are.
Yes, yes.
Okay. Firstly, many congratulations to both of you. Wonderfully
Thank you.
explained about the this GLP-1 and its relation to the chrono nutrition. I have one question in regards to this. These days, for the GLP-1s, is the getting attention on the PCOS or even the endometrial health as well. Um, what is your take on that? I mean, what is your point of view from in this way? Any of you can answer this.
So are you talking about GLP-1 from outside, or you want to naturally synthesize
No,
the
no, no,
GLP-1
outside.
from outside?
Outside.
And antagonist, GLP.
So, ma'am, in case of that, we already know that PCOD is it's something which like get influenced by the insulin sensitivity. It has a problem, right? So definitely we can give
Right.
GLP-1. So, but under the consultations of a doctor, of course, we have to see what is the status of a patient, having any history or not, can be able to tolerate. That's also important. It is not like a patient is coming and asking to give that just because it loses weight. It is not like that. We have to see. If it is possible, definitely we will be able to give under the consultations of a doctor, with the help of a doctor, of course.
I think
But
Okay.
Question is
it's
not that steady. Yes, Anindita ma'am, you can ask, you can answer because she is telling about the
I
endometriosis.
just I think it's not
Yes,
about
yes,
the
Anindita.
endometriosis or PCOD or any other disease. It depends upon how the patient reactions it is, because of the, if you, the craving is there, because lots of cravings is there, and I'm not handling my craving, then of course you can get. And if the patient is the endometriosis also, but they can manage their health nicely, I think it's not necessarily why I will give the GLP-1, because there should be a reason ना. तो it's not that factor जो उसके लिए आपका मतलब ovary ठीक हो जा रहा है, because endometriosis is a different issues. I think so, but generally what Jyoti wants to know, because endometriosis patients are going to be fat, so there we can apply definitely. And the craving and the mood swings are there. So many patient, maximum endometriosis patient, if you are handling 100 endometriosis patient, I think 98 patients can't control their craving. That's the reason they are putting their weight, getting their weight in higher side. So in that case, they can give. And it's you can ask as a dietitians, because how much you are controlling their cravings and how much you are obsessed about for food. It depends upon that. I think so.
And to add on this, Anindita ma'am, thank you so much for highlighting this, and both of you also, Lisa and Sriparna. Actually, the concerning point over here these days, you're talking about the moods, you're talking about the cravings. The estrogen dominance is also one such factor, which is actually creating this
Absolutely.
vicious cycle, like cravings, many other problems are actually coming up. So concerning question was that if these days women are getting more, this problem of this estrogen dominance is coming, where there is a less of the progesterone and more of the estrogen. So is GLP-1 is going to really help them out in that way as well? Because these days research is actually going on in outside countries. So my concern is that it's really going to be helpful also over here as well. Because
Generally, craving will be not there. So craving will stop. And she will full always bloated and heavy. So in that case, they will take the less calorie and they can maintain their body weight.
okay, okay.
मूड
Thank
स्विंग मूड स्विंग होने से भी ना उसको नहीं लगेगा मैं खाती हूँ. मूड स्विंग होने से she will going to the movie hall. She will call and चिल्ला भी सकते हैं, but they never feel hungry. Generally in that case ऐसा ही होता है.
Okay. Thank you. Thank you.
Thank you so much. Thank you, Jyoti, for giving that again an opportunity for the endometriosis. It's our favorite topic.
Thank you so much,
Rani,
ma'am.
Thank you, Shomendu. Thank you, Lisa. Thank you, Sriparna.
there is any other question? Dietitian Rani or from Satyarupa Balika Vidyalaya or something showing like that. Madam was there or not? Okay, Chitra having a question. GLP receptor agonist worsen gastrointestinal dysmorphia. Can GLP-1 receptor agonist worsen our GI motility? In the chat box, she has asked a question. Question is not so clear, but Chitra, if you can say what you want to know from us.
I think she is asking if the GLP-1 receptor.
Like whatever, yes, she. I think she is asking about this problem like nausea, vomiting.
Yeah. Actually, GLP-1 medication worsen the gut environment by killing some beneficial bacteria. So, for this reason, the prebiotic probiotic is very much important to colonize in the gut and to maintain the
you say about
GLP-1 activation.
Symbiotic, you
Yeah.
have very clearly mentioned about the role of the symbiotic. Very good, very good. Thank you. So no more questions we have. So we have both the fantastic speaker with us. We want you again in future. We have very good audience. More than 60-65 audience has joined, and it is really an interactive session. So on behalf of again IAPEN India, IAPEN Kolkata chapter, community core group, I really thank both of you and all the organizers for giving us the opportunity to conduct this kind of scientific session. Thank you. Good night, everyone.
Thank you so much, sir.
Thank you,
Good
everyone.
night.
Good night, sir. Thank you, sir.
Good night. Good night. Good night.